The mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines.
Well, it's a panel you just put those folks on. Far from what you said. They're people with ideas that are...
What is happening here? Jesus. Jesus Christ.
What you said were lies. You described people
Senator,
moving the Titanic.
Senator, are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis? Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel after firing the entire...
What's going on with our good friend RFK?
Reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
So let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Did he really? Uh-oh. Wait, what?
Wait, that was a statement.
I did not say that.
Okay, then let me ask, because you also...
Senator, I just want to make clear, I did not say that.
We'll check the
guidelines. We're going to get better food and better health in the American...
Wait, was it just...
You believe COVID-19 was politicized?
Oh.
Yeah, the whole process was politicized. Senator, I mean, we were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they prevent infection. It wasn't true. They knew it from the start it wasn't true because that's what the animal studies and the clinical trials showed. We were told that there was science behind cloth masks. The CDC allowed the teachers union to write the order closing our schools, which hurt working people all over the country, and then pretend it was science-based. All of these issues, and then I can show you, like, for example, Chairman Wyden was talking about me politicizing ACIP, but during COVID, Chairman Wyden was talking about me politicizing ACIP, but during COVID,
I don't know what ACIP is.
Probably the most famous scientist on ACIP was Martin Kulldorff from Harvard, the great, world-renowned epidemiologist and vaccinologist. And he criticized the COVID booster mandates. They ejected him from COVID because he wasn't in the orthodoxy. The two biggest health officials at FDA during COVID, Dr. Gruber and Dr. Krause, criticized the Biden mandates, vaccine mandate. President Biden said in August, I would never take that vaccine, the Trump vaccine. And he came in, he mandated.
I don't think he said that. I think that the statements probably weren't the most responsible, but they were like, I wouldn't just trust Trump. You'd have to make sure the science is okay, which you could argue is maybe not the most responsible statement, maybe. But I don't remember anybody ever saying, I would never take a Trump vaccine. No?
And then he fired the two top health officials at FDA who said, hey, this thing has not been properly tested. So the whole process was politicized, and even today.
So let me, in 15 seconds, so I think you answered yes.
Yeah, Kamala was the one who made that statement, yeah.
Well,
Biden might have said something too, right?
And I have concerns that when you look at some of the conflicts of interest in peer-reviewed articles in professional journals, and when you point out that even some of the...
I don't get, why is JFK always on the defense, and why is he that important to you? Because he's the head of our Health and Human Services, and he's destroying the health in this country right now.
Physician associations are conflicted because of the money they get from the pharmaceutical industry. Are you committed to trying to make sure that we use the best science and separate and eliminate politics as much as possible?
That is what my job is. That's what my mission is. Eliminate the politics from science.
Senator Bennett. Mr. Secretary, in June, you fired every member. Mr. Secretary, Mr. Secretary, may I have my time back, Mr. Chairman?
Not even listening, Dave.
Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the as I said, Dr. Malone is one of the inventors of the mRNA vaccine.
That's not how that works. He didn't work on any vaccine. It's such a stupid thing that this guy published something in like 95 or something relating to the technology, and he calls him an inventor of the vaccine. It's such a stupid thing to say.
He knows a lot more
that
about
statement,
it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made.
Thank you.
Just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
the obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So,
well, it's a panel you just put those folks on. Far from what you said, they're people with ideas that are...
What is happening here? Jesus Christ.
Folks
did he stop to let him
on? Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these?
I assume they will be.
No, they won't be. He's lying.
I will hold you to that, Secretary Kennedy, because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school.
This is the pulmonary system that carried him through 100 push-ups and 100 pull-ups? Really?
Have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described people moving the Titanic.
Senator, are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel after firing the entire...
You're evading the question.
No, I'm asking the questions here.
You're evading that question.
I'm asking the questions, Mr. Kennedy. I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Wow.
Senator Cassidy.
Thank you. I'll try and restore a little calm here. And I'm approaching this as a doctor, not as a senator. I am concerned about children's health, seniors' health, all of our health. And I applaud you for joining the president in a call for radical transparency. Thank you for that.
Thank you.
I said yesterday, I believe it, that President Trump deserves a Nobel Prize for Operation Warp Speed. If he had been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars, we reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
So let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait, real quick. Whoever does my sound things, I need to get all the breathing sounds from this guy. I just need a whole soundboard of the breathing sounds, please, God.
That was a statement.
I did not say that.
Okay, then let me ask, because you also...
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. Now, let me ask.
I'm happy to explain why.
Yeah.
I have 3 minutes and 30 seconds left. It also surprises me because you've canceled, or HHS did, but apparently under your direction, $500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems, this is canceled, it seems like an incredible waste of money. But it also seems like a commentary upon what the president was attempting, what the president did in Operation Warp Speed, which is to create a platform by which to create vaccines. So this just seems inconsistent that you would agree with me the president deserves a tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this a speech that you don't want me to answer? Because I want to answer that question.
Please.
If it's a question.
But be tight, please.
First of all, the reason that Operation Warp Speed was genius is it did something nobody had ever been done. I don't think any president, but President Trump could do it. It got the vaccine to market that was perfectly matched to the virus at that time when it was badly needed because there was low natural immunity and there were people getting very badly injured by COVID.
Do you think he ever says pharmaceutical in this answer? Who made the vaccines?
And then, but it was also brought in therapeutics like hydroxychloroquine and ivermectin and protocols for treatments.
I'm sorry, Operation Warp Speed brought in ivermectin and hydroxychloroquine? I thought Operation Warp Speed, I thought was just a pre-agreement to purchase like in advance, like a huge stock of vaccines, basically. Operation Warp Speed, therapeutics and diagnostics. Oh, did it include other things as well? Fact sheet explaining Operation Warp Speed. Okay, I don't think Warp Speed ever went to this stupid shit, but Operation Warp Speed aims to deliver 300 million doses of a safe, effective vaccine for COVID-19 by January 2021 as part of a broader strategy to accelerate the development, manufacturing, and distribution of COVID-19 vaccines, therapeutics, and diagnostics, including those countermeasures. Okay, so it's mainly about vaccines. Okay.
And there were no mandates. And
Okay, I have another question, so please.
That's when I began litigating against President Biden's mandates. Now,
I'm sorry, let me go on because
in terms of me canceling those contracts.
I have limited time, Mr. Secretary, I'm sorry. You've called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest. I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP. And
was ivermectin ever considered a therapeutic? Not by any scientific community, no. Ivermectin has never been demonstrated in any clinical trial to be effective at doing anything to help with COVID-19 or SARS-CoV-2.
Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board.
Excuse me,
can I have my time back?
Yes.
Yeah. What I am concerned about is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers.
Uh-oh.
Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science.
Uh-oh.
If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay.
Oh, so conflict of interest is fine. But you know who's working for the drug companies and who's working for the FDA, right? Don't they know that too? Or
it's not a financial conflict. It's not a financial conflict.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID. This is from Eric Erickson, good conservative out of Atlanta, Georgia. Occasionally gives me help. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient requested but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Thank you, Mr. Chairman. Following up on that same line as Senator Cassidy, because that's exactly, I represent one of the most science-based states in the country. That is percentage of scientists per capita.
Hold on. Is this a debate? tactic? Because I feel like he's throwing him off. Listen how she like pauses, right? Do you think this is a strategy?
Represent one of the most science-based states in the country. That is
Like she's like losing her train of thought.
capacity, because that's exactly, you know, I represent one of the most science-based states in the country. That is percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives? And you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. You could say
I
yes.
said the president also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone, are those.
You canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So yes.
Really, pertussis? Is that even a real disease?
The governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because of the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that? Leaving us more vulnerable to some other country, keeping the advantage on having the best technology. So I'm telling you, that's about technology. I have two other quick questions for you.
These questions or statements, because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the enhanced premium tax credits?
Yes.
Well, the Democrats had two chances to make them permanent, and they didn't. And they didn't for a reason.
We're the ones who delivered it. So I'm just asking yes or no, do you want to do something about this? Yes.
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump wants to do.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein. Do you think they were a hoax yesterday?
Do I think they were?
Do you think they were perpetrating a hoax yesterday?
Perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first time hearing about it.
Oh.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you're perpetrating hoaxes.
Oh my God! See, the grand strategies, the debate tactics have filtered all the way up through to the highest levels of government. I don't know. Haven't heard about that.
You, as the Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that, but it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
Thank you. Senator Warner.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped. I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when you met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this. That seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of CDC, and there was so many perverse incentives. And these are model
you don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 monmonths, and you don't know the data about whether the vaccine saved lives?
And that's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
Fired Dr.
Go to Trump, Surgeon General.
They fired Dr. Graf. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Cowles.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, I remember when we went through the hearing with you.
At some point while watching this admin, do you feel like angry, or are you past that emotion for these guys now? I imagine I'll be more emotionally invested maybe come midterms. Right now, everything just feels like worthless. Like, it's all like a joke. Like, RFK knows it's a joke. Everybody in this cabinet and this admin knows it's a joke. And then like actual like frontline Republican voters know it's all a joke, I guess, because they don't seem to give a fuck about anything either. So, I mean, like, best case scenario, all the downstream health impacts from what they're doing, erodes that part of the voter base through population attrition or increased occupation of graveyards. And then maybe we just go back to normal. I don't know.
I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you got the one. I think in April. I tell you what I hear on community health centers, they are terrified. With all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There's not a single, some of my Republican colleagues, but there's not a single study that does not, I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean,
what is this?
What you'd expect an earthworm to sound like as it's dragging itself across silty soil.
The aim now is to gather more data and improve.
Why?
So, should we try and put some worms in then and see if I can hear anything?
Oh, this is the...
That's extraordinary. And there you hear it. You hear this tiny little...
You're supposed to be doing healthcare policy, not being the doctor in residence for all of America. I in Virginia, and hear what is on...
Senator Lankford.
Mr. Chairman, thank you. Secretary, good to see you again. As I traveled around Oklahoma during
mad.
August, it's
Damn.
great to be able to be home. I had several folks that contacted me, and we had some great meetings with some rural hospitals as well. They're looking forward to the $50 billion for the One Big Beautiful Bill that is targeting towards rural hospitals, starting with $10 billion next year. I know you're quickly getting all the instructions out on that. We know that's in process. It was good to be able to visit with them and be able to talk about that. They're very pleased. Thanks for the work you're doing on that. I also met with some of our groups that do incredible medical research on this. I know the NIH grants were held for a while and being studied. Those have been released, and grateful to be able to see that because there's some amazing medical research that's happening, including some longitudinal studies. They need those dollars released, so I appreciate y'all getting those released out there. I did hear from a lot of our folks, and I want to talk about one of these issues. From a lot of our hospitals, they immediately raised the issue of Medicare Advantage plans and how they're withholding payments, they're delaying payments back to hospitals, and the problem that's been for rural hospitals. I know y'all are working on that as well. We want to work with you on that. But you and I have spoken on the second issue on that, and it's the pharmacy benefit managers. During the confirmation process, it was interesting when you and I met in my office, you said every single senator brought up PBMs to you, and you made the statement during the confirmation process, this is an area that President Trump wants to take on, is the pharmacy benefit managers. This is unfinished business in this committee, but I wanted to just know what is HHS doing at this point on the PBM issue in particular to make sure we're not driving out rural pharmacies and what we can do to be able to make sure that's fair.
I mean, it's a priority for the president. He talks to me about it, I would say, at least once a week, sometimes at 11 o'clock at night. And we've met with the PBMs, and we are in talks with them. We're also in MFN talks with the pharmaceutical companies who are also very interested in reducing the cut and getting transparency among the PBMs. And the PBMs have committed to us to transparency, to some protocol that will guarantee transparency. And then the part of the MFN negotiations would include direct-to-consumer marketing, which would eliminate the middleman. So I think we're doing a lot of PBMs.
Okay, that'd be very helpful to be able to see. It'd be very helpful for consumers across the country on this. You and I spoke as well, and you've made public statements on this, and the FDA commissioners made public statements on the issue of reviewing the safety issues of mifepristone. Your comments early on were every drug needs to be treated the same, needs to look at the same and not have political biases and how things are actually examined. There were a lot of changes on the allocation of mifepristone for elective abortions under the Biden administration. It's now open to anyone without a prescription on it. You don't have to go through a doctor on it. There's all kinds of issues that are happening now on it. So the question was, you said that there would be a review on that just to be able to look at it, make sure we're following all safety protocols. Do you know a timing on that review?
I can't give you the exact timing. I talked to Marty McCary about it yesterday, and he said it is progressing apace. We're getting data in all the time, new data that we're reviewing, and we know that during the Biden administration, they actually twisted the data.
RFK Jr. is actually the most popular member of Trump's admin.
You know, Harry, it's interesting. All morning long, I've been saying Secretary Kennedy could be the most embattled member of the cabinet. Fact check me here.
No, I think that's a false. That's a Daniel Dale fact check for you. False on that. What are we talking about here? Net favorable ratings of key Trump officials. Look at this. RFK Jr. ain't exactly popular, but he's the most popular of all the key officials that we have recent polling on. Pete Hegseth, his net favorable minus 14 points. J.D. Vance, minus 11. Marco Rubio, minus 10. RFK Jr. is at minus 7, but minus 7 beats minus 10, beats minus 11, beats minus 14. So, no, RFK Jr. is not a drag on President Trump. He's not the most embattled. In fact, he is the most popular official in Trump's cabinet, at least according to the polling.
It is interesting. So there have been calls for his resignation among some people in the CDC, but this was surprising to me to see these poll numbers here, which is why I welcomed the fact check from you. Another thing in the news has to do with Florida, where they're trying to overturn all vaccine mandates, including vaccine mandates in school for children. What do the polls tell us about that?
Okay, this to me is one of the most interesting and, in my opinion, most troubling trend lines that we have seen. Okay, vax kids against infectious diseases, the government should require it. You go back to 1991, it was 81%, okay? Then we go to 2019, it's 62%. Look at where that number fell to by 2024. It was just
51%? Really? I wonder what the partisan split is on this. If it's like, hopefully it's like what, like 80, 85, 30, maybe? 80 to 85% of Dems being in favor, 30-ish% of Republicans. It wouldn't be lower than 30%, right?
51%. That is a 30-point drop from 34 years ago. My goodness gracious. Now a bare majority say that the government should, in fact, require kids to be vaccinated against infectious diseases. Amongst Republicans, it's the opposite. The majority say the government shouldn't require it. Now, I should point out this does depend a little bit on question wording. The polling out this morning says that the government should encourage it, but encourage it is very different from requiring it. And when it comes to requiring it, the American public has become increasingly skeptical of the idea that, in fact, the government should require kids to be vaccinated
No party breakdown?
And I want you here to talk about the political environment surrounding the health apparatus in this country right now, because I'm about to talk to David Urban, our friend David Urban, Republican, who I guarantee you is going to say something to the effect of that there's no trust anymore, the trust has fallen among public officials when it comes to health.
Yeah, this to me, if you're a public health official, this is perhaps the most worrying statistic that you should see. Look at this. Look at this. How well masks and vaccines limit COVID? Public health officials lied. They lied. In 2022, it was 45%. Look at where that number is now. 55% of Americans believe that public health officials lied about COVID, masks, and vaccines, and their effectiveness. So, yeah, there's a lot of problems. I think David Urban's going to have a lot to chew on in this upcoming segment, John.
All right, Harry, thank you.
I'm not sure I'm pro-requirement for COVID vaccines and especially boosters. Probably not. Right? I don't think we require kids to get flu shots, but this sounds like all vaccines, no? Like there's probably sets of vaccines that almost everybody that goes to school should be required to get, no?